Hello, and welcome to Healthy Homes for Families with Asthma. This video is part of a series of resources designed for community healthcare workers, community healthcare representatives, promotores de salud, and anyone interested in helping families stay healthy by controlling asthma in the home. A recent study in 2014 in New Mexico showed that about 150,000 adults and 47,000 children are affected by asthma.
The report estimates that asthma prevalence among adults has increased steadily since 2000 and is currently 10%. 52% of adults and 38% of children with asthma do not have their asthma well controlled and are at risk of an asthma attack. Only 43% of children with asthma have an asthma action plan. Children with asthma are living with triggers in their home. 72% have carpeting or rugs in their bedroom. 43% have pets in their bedroom. 34% have a wood stove or fireplace. 9% have cigarette smoke in their home. Asthma hospitalizations, which are largely preventable, cost $30 million in 2009. $20 million of those costs were charged to Medicaid and Medicare.
Hi. Good afternoon.
Yeah, you can have a seat right here.
Okay, thank you.
As a community health worker, you play an important role in helping families address these issues by educating people with asthma and their families on how to control asthma in the home. To do this, it's important to understand the best practices for asthma management and how to use these strategies with clients. This video and the resources found on our website will provide you with the information needed to guide families you serve and help them control asthma and create a healthier, safer home. In this video, you will learn about asthma, the medications and devices used to control the disease, asthma action plans, the 7 healthy home principles, common household asthma triggers, and strategies to remove or eliminate them. During this presentation, we will refer to a number of resources you can use to learn more about asthma and share with your clients.
So, asthma is one of the most common chronic conditions affecting adults and children in the United States. While we don't know how to prevent asthma from occurring, we do know how to control it. We can control it with medications and by reducing or eliminating asthma triggers.
Asthma is a chronic disease of the lungs. During normal breathing, air flows freely in and out of the lungs. But during an asthma episode, breathing becomes difficult because the lining in the airways swell. Muscles around the airways tighten and mucus clogs the tiny airways. This results in wheezing, coughing, breathlessness, or tightness in the chest. As a community health worker, you may be approached by clients who describe these symptoms. When this happens, encourage them to see their healthcare provider. Before asthma can be properly treated, it must first be diagnosed. Once diagnosed, their healthcare provider will choose the best plan and medication to manage the disease. Your job as a community health worker is to stress the importance of using their asthma medications as prescribed and going for regular checkups even when they are feeling fine. Clients may also ask you for advice regarding their asthma, like if they can do certain activities, or how they should use their medication, or whether their insurance coverage will pay for the equipment. When questions like these come up, always refer them to their healthcare provider and offer to help them create a list of questions they can ask their provider during their next checkup.
The first strategy you will reinforce is the proper use of medication and devices to help control asthma as directed by a physician. There are several types of medication. The first type is designed for long-term control. There are many different brands, but both reduce inflammation and help keep the airways open.
These medications are often used with a peak flow meter, which is used to measure how well a patient's lungs are working. The patient quickly exhales into the meter and a reading is taken. These readings can show gradual changes in lung capacity, even before the patient feels any difference in their breathing. These readings monitor how well the lungs are working and can be used to determine when to follow the steps listed in the patient's asthma action plan, which we'll address in a moment. The second type of medication used for asthma is short-term, quick relief medicines that are taken when symptoms occur. They are used for immediate relief and sometimes called rescue inhalers. These medications expand the lungs' airways, allowing air to move freely in and out. Other medications used by patients include allergy shots or medications designed to reduce allergy symptoms. These medications help manage allergies that can make asthma worse. Ask your clients if they are using their medications as prescribed and encourage them to continue to use them even when they are feeling good.
If they've stopped using their medication, stress the importance the control medication has on keeping the airways clear. Reinforce the message that inflammation in the lungs can be gradual, and that by staying on their medication, they can prevent asthma attacks before they occur.
Find out why a client stopped taking their medication. Maybe they have run out, can't afford it, or don't have transportation to pick up their prescription. Work with your client by pointing them to the resources in the community to get the support they need.
The next strategy is the use of an asthma action plan. This is a plan developed by a client's healthcare provider in controlling their asthma. It is a proven tool to control asthma. When an asthma action plan is followed, asthma symptoms are more easily managed, leading to fewer hospitalizations and better quality of life.
An asthma action plan is a series of steps that varies from person to person, but each asthma action plan provides the patient with guidance on how to use their medication with steps to follow depending on how well their asthma is being controlled. When you visit with your client, ask if they have an asthma action plan. If they do, ask to see it and find out if it is being used. Let them know that using an asthma action plan is a proven strategy for controlling asthma and can reduce the chances of hospitalization and doctor visits if followed. If they have a school-aged child with asthma, find out if the school nurse has an asthma action plan on file. Here's an example that uses a stoplight format where the green light means the asthma is in control. The yellow light means asthma symptoms are developing and the asthma is getting out of control. And the red light means the asthma is out of control.
Action plans have a section that assesses how the patient feels and any symptoms they may be experiencing and the action to take based on those symptoms. For example, the action plan may describe the following symptoms: difficulty breathing, coughing, wheezing, tightness in the chest, difficulty working and exercising, being awake at night due to coughing. Now that we've talked about asthma medication and asthma action plans, the next strategy that you can support is to help families reduce or eliminate asthma triggers.
By paying attention to what triggers their asthma symptoms, asthma attacks can be avoided. Here are some things to consider. Does their asthma get worse during certain times of the year? Are there places where they develop asthma symptoms? Do certain smells trigger their asthma? Do certain activities cause asthma symptoms?
Let's get into the field and talk about common asthma triggers, where to find them, and what techniques to use to reduce or eliminate them.
When it comes to allergens, some of the more common triggers include dust mites, pests such as cockroaches, mice, and rats, pets, and mold. There are also a number of irritants that can make asthma symptoms worse. These include secondhand smoke, consumer products with odors such as air fresheners, cleaning supplies, fragrances, and personal hygiene products, and smoke from cooking food, fireplaces, and other combustion appliances.
So where do we find asthma triggers? A good place to start is in the home. We all spend a lot of time in our homes, and there are many potential triggers there that can have a direct impact on asthma. The good news is that these triggers can be reduced or eliminated through changes in behavior, education, and improving the home environment. A healthy home is accomplished by teaching families about the 7 healthy home principles and how they can be applied to make their home healthier and safer. The healthy home principles focus on keeping the home dry, clean, pest-free, ventilated, safe, contaminant-free, and well-maintained.
Let's go into more detail on these principles and how they apply to asthma. The first principle is to keep the home dry. This is essential because excessive moisture can lead to mold, attract pests, and promote dust mite populations.
Keep the home clean. When applied, it can reduce the risk of bug infestations and exposure to other contaminants like dust, pesticide residues, and other toxic substances.
The pest-free principle is important because many pests, such as cockroaches, rats, and mice, produce allergens that can cause allergic reactions and make asthma worse.
All homes need good air to be healthy. A well-ventilated home is essential. This principle emphasizes the need to bring good air inside and exhaust bad air outside. As a community health worker, ask your clients about the systems in their home that allow for ventilation. Ask them questions like, do these systems exist? Are they being used? And how well are they working? Keeping the home safe does not always address asthma issues, but focuses on home hazards that could cause injuries, falls, burns, poisonings, and other safety-related issues. When addressing your clients on asthma, you can always point out these concerns and encourage them to address them.
There are many contaminants found in the home that are brought in or built up over time. Being contaminant-free reduces or eliminates toxins, which can irritate the lungs, causing asthma symptoms, as well as other health problems. This principle centers on family behaviors, products used in the home, and materials used when the home was built. The home can be contaminated by smoking inside, leaky fireplaces, cooking practices, use of products that release volatile organic compounds, and toxic substances like pesticides, lead, asbestos, radon, and other common household chemicals.
The final principle is in the maintaining of the home. Here, attention is given to routinely inspecting the home, making repairs, changing filters, and maintaining equipment. The goal here is to address issues before they cause a problem. When working with clients, sharing information about asthma triggers and how to create a healthy, safer home can be done in a variety of ways. The most effective is the home visit.
Home visits give you the opportunity to talk to the family, do a home inspection, identify potential problems, and offer recommendations. When doing a home visit, it's important to make the client and their families feel comfortable. Create a safe place for them to talk. Be aware of how you are communicating verbally and through body language. Pay attention to their body language and adjust your presentation as needed. Keep in mind that your role is to help raise awareness and provide strategies. Build on the inherent strengths of the families you are serving, and provide them with ideas that can improve their home environment, and brainstorm solutions together. A good way to start is to use a tool with interview questions that give you a general idea of potential issues to look for during the home inspection and a checklist to document issues found in each area of the home. There are also a number of handouts you can share with your clients that provide details on what to do to address these issues. The Help Yourself to a Healthy Home booklet provides excellent recommendations for families and can be used during the education part of the home visit to reinforce a healthier, safer home. Examples of useful tools and resources can be found on our resources page.
When conducting the home inspection, take note on how the home smells. Does it smell damp, musky, or smoky? Is there a chemical odor? If you notice a strange smell, investigate where it's coming from. It could indicate a problem, like mold. Then try to identify the source, like a moisture problem.
As you progress through the home, remember to always communicate with the client and explain what you are looking for. Also, reinforce the 7 principles of healthy homes. Look for moisture problems, home cleanliness issues, pests, contaminants, ventilation problems, and maintenance issues. Now let's get into the field and walk through several homes and talk about common asthma triggers, what to look for, and strategies for reducing or eliminating.
Dust mites are one of the worst allergens for people with asthma. These small organisms cannot be seen by the human eye. These microscopic bugs live and thrive in warm, humid conditions and feed off of dead skin cells. Dust mites like moist environments where people spend time. When doing the home inspection, look in bedrooms or places in the house where people rest, sleep, or sit.
Here are some typical areas where dust mites may be found: pillows, mattresses, upholstered furniture, stuffed toys, carpeting, curtains, and areas where dust collects, such as bookcases, shelves, and windowsills. It is important to understand that dust mites cannot be completely eliminated from a home, but their numbers can be reduced and the amount of allergens can be controlled. The main strategy to control dust mite allergens is to keep the home clean. Here is what clients can do to reduce dust mites. Wash sheets, bedding, and other fabrics in hot water to remove allergens and kill mites. Use mite-proof covers for mattresses and pillows to create a barrier for mites and their allergens. Kill dust mites by drying fabrics in a clothes dryer. For thin fabrics like sheets, drying in the sun can also kill dust mites. Regularly wash and dry stuffed animals if possible. This removes the allergens and can kill the mites that build up in the fabric. Stuffed toys should be stored away from the bed. If fabric or toys cannot be washed, they can be vacuumed and put in a plastic bag and then frozen. Freezing kills mites. Regularly vacuum bedrooms, living rooms, and other areas of the home. When vacuuming, it is recommended that a HEPA vacuum be used. HEPA vacuums use a high-efficiency particulate air filter that capture very fine particles including allergens. Stress to the family that individuals with asthma should not be present or should wear a dust mask when a room is being vacuumed. When vacuuming, allergens can become airborne and can trigger asthma.
HEPA vacuum cleaners, like any other vacuum cleaners, must be maintained and the HEPA filter changed. If a family does not have or cannot afford a HEPA vacuum cleaner, you should still encourage them to routinely vacuum.
Advise families to read instructions on their vacuum and to make sure it's operating properly. When vacuuming carpet, it is recommended to vacuum in one direction and then vacuum at a 90-degree angle. This helps remove more dirt and allergens from the carpet. Use the hand tool to vacuum the sides of small area rugs. The hand tool is also useful to vacuum furniture, curtains, and other surfaces. Again, recommend to the client that the person with asthma leave the room when vacuuming. For more details on how to choose a HEPA vacuum and other information on proper vacuuming techniques, refer the family to the resources page on vacuuming. Another cleaning step to reduce dust mite allergens is regular dusting and mopping. Dust provides a food source for mites and also traps other allergens and contaminants. When dusting, stress the importance of not dry dusting or sweeping, a practice which just moves the dust around and into the air. The best way to dust is to use a damp dusting technique, which minimizes dust or cleaning solutions from getting into the air. Another technique uses two buckets. One is filled with cleaning water or cleaning solution, and a second bucket is rinse water. Wet a towel, sponge, or mop in the cleaning bucket or solution and then clean the surfaces. This removes the dust. Then rinse in the rinse bucket and dip into the clean bucket and repeat the process. Repeat these steps until the rinse bucket is dirty and replace the water. When using a cleaning solution, pick one that does not have a strong odor and avoid spraying it into the air. It is better to pour the product onto a towel or sponge so it does not become airborne. One final strategy to reduce dust mites and their allergens is to keep the humidity levels in the house below 50%. Dust mites like humid environments, and by keeping the home dry, you can substantially reduce their numbers. If moisture is a big problem, recommend using a dehumidifier. But remember, humidifiers must be maintained so they don't cause a mold problem.
Another common allergen is pests. Pests produce allergens by shedding body parts, saliva, and fecal matter. Pests can be an asthma trigger to sensitive people. Common pests include cockroaches and rodents.
Look for evidence of cockroaches in or around damp and warm areas, such as water heaters, laundry areas, appliances, and plumbing fixtures. Look for their droppings or frass around baseboards, electrical sockets, crevices in the kitchen and bathroom, and exterior walls and windows. These droppings look like greasy flecks. When checking for signs of rodents, look for droppings. Mice droppings are about the size of a grain of rice, and rat droppings are a little larger and are either black or brown in color. To have a pest-free home, recommend using an integrated pest management approach. This focuses on eliminating what pests need to survive: food, water, and shelter. Start by eliminating food sources. Here are some recommendations. Store food in sealed containers. Immediately clean spills and remove food particles off counters, shelves, and floor. Wash dishes promptly after use and dry out the sink to remove standing water. Use a covered garbage bin and recommend the garbage be taken out daily if the pest problem is severe. If there are pets, remove their bowls after being fed so pests are not fed as well. Next, eliminate any sources of water pests may be using. While inspecting, check under the sinks for leaks and other potential sources of water, such as drip pans for air conditioners and refrigerators.
As always, regular cleaning should be done. Routinely cleaning under refrigerators, stoves, and other similar appliances will eliminate pest infestations and places pests find shelter. Look for cracks in the cabinets, holes in the floors, walls, or light receptacles, or any other place pests would hide. Inform clients to reduce clutter in rooms and areas, making it easier to clean. This also will make it harder for pests to find shelter. To prevent pests from entering the home, look for openings into the home, and if present, block the holes with sealant or caulking. You can use a copper wire mesh on gaps in areas used for plumbing, heating, and cooling.
There are many good handouts that provide guidance on how to keep pests out. You can find them on our resource page. If these steps do not work and the pest problems continue, pesticides can be used. First, clients should try poison baits, boric acid, and traps. Avoid at first using sprays and foggers. If they decide to use these forms of pesticide, recommend that they ventilate the room well and keep individuals with asthma out of the room when such sprays are being applied.
Pet allergens are another asthma trigger and can come from dogs, cats, and other furry animals. It is the pet dander, or skin flakes, hair, urine, and saliva that are allergenic.
Pet dander is difficult to remove from the home, so the best solution is to recommend removing the pet. If this is not possible, here are other steps a family can take to minimize exposure. Keep pets outside. Keep pets out of the bedroom. Keep pets off upholstered furniture. Wash and comb pets and wipe them off when they come in from outside. Use a HEPA vacuum and clean areas where your pets spend time. The cleaning steps used for addressing pet allergens are similar to addressing dust mites. Regular cleaning is the main strategy. Inform the client that even after a pet is removed from the home, it can take up to 6 months of regular cleaning for pet dander levels to return to levels of a home without a pet.
Another household allergen is mold. Mold spores are everywhere. They can grow in and outside the home. The problem is when there's moisture. If materials are allowed to stay wet for 24 to 48 hours, that's when mold can grow. There'll be an increase in mold spores and mold particles. This is what triggers asthma.
When conducting a home visit, look for these signs in areas for excess moisture. From inside the home, notice the smell. Often you can smell a mold problem. Check walls, ceilings, and other areas for water damage and determine the cause. Find places where condensation builds up, which include on or near windows, or where walls and ceilings lack insulation. Poor ventilation in bathrooms can cause mold growth around tubs, showers, walls, or near windows. Look for standing water around houseplants and in drip pans for the refrigerator and air conditioner. Leaky plumbing under sinks or in crawl spaces can contribute to mold and mildew growth. Evaporative coolers not maintained can promote mold growth on the pads and in ductwork. Kitchens and laundry rooms can contribute to excess moisture from outside the home. Check rain gutters for debris, leaks, and if it is draining properly. Notice the roof structure. An old roof can lead to leaks. Walk around the foundation to see if water pools around the home. This can cause water damage. To address moisture problems, recommend the following. Fix leaks in the ceilings, walls, and plumbing fixtures. Use exhaust fans in the kitchen and bathrooms to reduce moisture. Make sure dryers vent to the outside. Install windows and exhaust fans in areas of the home with poor ventilation. Use or install exhaust fans and windows in areas with poor ventilation such as kitchens and bathrooms. Regularly drain and clean drip pans for appliances such as refrigerators and window air conditioners. Repair structural and drainage issues to direct water away from the foundation. Some issues may be too large for a family to address. In these instances, recommend they hire a contractor or work with their landlord to correct the problem. If mold is found, the client can clean the area using hot water and non-ammonia soap with a stiff brush. Rinse the area with clean water and dry the area out. Using a fan can speed the process. You may be asked about cleaning with bleach, but this is not recommended for homes with an asthma patient because it is actually a trigger. However, using bleach is appropriate when there is moisture issues caused by flooding or sewer backup. In this case, make sure there is plenty of fresh air and the person with asthma is out of the area. Stress to the client that mold will return when moisture remains. It's important to solve the problem permanently by fixing the cause of the moisture. The next set of triggers to look for are air contaminants that irritate the lungs. These include secondhand smoke, common consumer products like air fresheners, scented candles, home cleaning products, scented perfumes and lotions, incense, paint, and other products with strong odors. These can release volatile organic compounds, also known as VOCs, into the air and can irritate the lungs. Smoke and gases produced during cooking, burning wood, and using combustion appliances can produce fine particles and toxic compounds that are irritating to the lungs. Dust is also a type of contaminant and can contain allergens, lead, asbestos fiber, and other harmful substances. These all contribute to poor indoor air quality and can be a problem for people with asthma. The strategies to reduce contaminants in the home include: make the home smoke-free. If a family member smokes, encourage them to quit, and share information about smoking cessation classes and encourage them to enroll. If they are going to smoke, recommend they smoke outside and away from the person with asthma. Recommend the use of less toxic, non-scented, environmentally friendly products. There are many green products that are safer and less irritating to the lungs. When buying products, look for those that are unscented, fragrance-free, and hypoallergenic, and labeled low VOCs. You can also encourage families to make their own green cleaning products by sharing the recipes on the resource page. Encourage the use of exhaust fans when cooking and bathing, or open windows to bring in fresh air. Reduce dust and dirt in the home through regular damp dusting and mopping. Prevent dust from entering by placing dust mats outside and inside entrances. Recommend shoes be taken off when entering the home.
Thank you for taking the time to learn about asthma, some of the potential triggers, and how to avoid asthma attacks in the home. The information on this video and the resources found on our page will help give you the foundation you need to help the families you serve. As a community health worker, your visits could be the difference between helping those who suffer from asthma and those who lead a healthier, fuller life. Thank you for the work you do.